Hello everyone, in this video we are going to discuss another important concept, that is transferrin saturation versus ferritin iron study simplified. So what is transferrin saturation? It is a percentage of transferrin iron binding sites occupied by the iron. So what are the sites occupied by the iron at the transferrin iron binding sites? It is a transferrin saturation. So it is calculated by serum iron by transferrin iron binding capacity into 100. The normal range is 20 to 50%. It is low in iron deficiency, anemia, and also chronic disease, whereas it is high in iron overload, that is hemochromatosis, and also in hemolysis. It is not an acute phase reactant. It is used in detection of functional iron deficiency or functional iron overload. It is affected by recent iron intake and also transferrin changes. So what we have to remember is, it is a percentage of iron binding to the iron binding sites of the transferrin. So whenever there is more iron, there it is more. Whenever there is less iron, it is less. So it is nothing but a binding of the iron. So it is changed with the recent iron intake. It is not an acute phase reactant. Coming to the ferritin, it is a total iron stored in the body. So it is directly measured in the serum. Normal range is 30 to 300 nanograms per milliliter. So it is low in iron deficiency anemia because iron storage will be less. It is high in iron overload and also in an inflammation and liver disease, because inflammation is high because ferritin is an acute phase reactant. It will be increased in inflammation. So it is used as a best indicator in early iron deficiency, but limitation is it is elevated in inflammation, so it may mask deficiency in those cases. So why we need to know this are because whenever there is decrease in the ferritin, iron stores are depleted in the body. Whenever there is decrease in the transferrin saturation, there is less iron available for the use. So transferrin is more of functional thing, ferritin is more of storage thing. So how we can differentiate different anemias by this is, in iron deficiency anemia there is less iron stores, so there is less ferritin, and also there is less iron available for the binding, so there will be less transferrin saturation. Whereas in anemia of chronic disease, it is different. There is less iron available for binding, so there is decrease in the transferrin saturation, but the ferritin levels are normal, or sometimes these can be increased, because in chronic disease these are increased because it is also an acute phase reactant. So in these cases, to differentiate the functional anemia from the other anemias, we can use this ferritin and the transferrin saturation. The important keynote point is, if ferritin is high or normal but transferrin saturation is low, consider functional iron deficiency, that is chronic disease, that is anemia of chronic disease or in chronic kidney disease. So this is an important